Hello,
Hello.
I am Dr. Bishas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I am Paul Coelho, 35 years.
Okay. Nice to meet you, Mr. How can I address you?
Yes, you can tell me Paul.
Okay, Mr. Paul. I got a letter from your GP saying that you have cough for last few months. Is it right?
Yes, doctor.
I'm going to take detailed history and during our discussion, I may take some notes, but all the information during our discussion will remain confidential. So is that okay for you?
Yes, doctor. It's completely okay.
Okay. So can you please tell me in your own words what is happening with you?
Well, doctor, I think for the last 2 or 3 months, I have been facing cough. Okay. At the beginning, doctor, uh, this was not too much. It was quite dry actually, but as the days are passing by, I think it's more or more producing phlegm. And one or two times I also noticed some blood, doctor, mixed with my phlegm. So I am a bit worried, doctor.
Yeah, I'm sure to hear that. And you said that it started about 2 months back.
Yes, doctor.
And do you think that it is increasing in frequency, the increasing the frequency of cough day by day?
Doctor, I think it's increasing day by day.
And can you tell me that how when you start coughing, how long it persists?
Doctor, I think these episodes persist for around 1 to 2 hours when it starts.
And how many episodes in a day?
Many episodes, doctor. Not really, I think 2 or 3 episodes in a day, and for the last 2 or 3 months, many episodes.
Have you noticed any variation in the timing, like just more in the morning, more in the evening, or more in
Doctor,
the
I
night?
think that it's a bit more in the early morning, doctor.
And you said that you are producing flame. Can you estimate what would be the amount?
I think, doctor, around 2 cups.
And for how long?
Doctor, I think for actually around 2 months, doctor.
And 1 cup a day, 2 cups a day.
I think, doctor, yes. So,
Can you say me that what is the color of the flame?
yes, doctor, I think it's sometimes greenish, doctor, a bit greenish, doctor. And recently I have also noticed some blood. I told you 2 or 3 times.
And can you tell me that what is the color of the blood? Is it bright
I
red?
think, doctor, it's a red, doctor. And another thing, actually, doctor, I told you that I have been not a very good, very healthy child. Okay, so from my childhood, I have been a bit sick, but I have never produced this type of phlegm. So it's much more worrisome for me. Okay,
Okay. And can you tell me that have you ever not coughed out only blood?
no, doctor, I don't think so, but I think it's mixed with phlegm. But I can notice it. I can understand that it's blood.
Okay. And along with it, do you have any shortness of breath?
Yes, doctor. I think so. I have some shortness of breath, doctor. I
For
think.
how long?
Yes, doctor. I think it's for around 1 or 2 years, doctor.
And have you noticed that what brings the shortness of breath? Any work or you suddenly develop shortness of breath?
Doctor, I don't think that it's related to work that much. I can just only say that, but I haven't noticed that whether it's related to something else.
Can you tell me that what brings the shortness of breath, like lying down or coughing or anything else?
No, doctor, I don't think that lying down. Sometimes I think coughing brings a bit shortness.
And how much it is affecting your life, the shortness of breath?
Doctor, it's affecting so and so, but I'm much more worried about this phlegm.
Okay. And do you have any chest pain?
Doctor, it's very rarely, doctor, not always.
And can you say me that where do you feel the pain?
Doctor, I think it's more in the sometimes it's in the right, sometimes in the left, but I think it's very vague, doctor.
Okay. And do you feel any feverish or high temperature?
Yes, doctor. I told you that I have been a sick child from my childhood, so I have felt these problems many times. this type of feverish, raised temperature, and also some cold issues many times.
And this time, do you have any fever?
Yes, doctor. At the beginning, I think I had some fever, but now I cannot realize that I haven't measured it.
Do you produce any excessive sweating at night?
No, doctor.
And may I know that do you have any headache?
No,
Any changes in your vision?
no,
Any changes in the color of your eyes?
no,
Any reaction in your body?
no, doctor. I have noticed.
Any nasal blockage or runny nose?
No,
Any crusting through the nose?
no,
Any problem in your ears?
no, doctor. I have noticed.
How about your appetite?
It's quite good.
Have you noticed any changes in your weight?
Yes, doctor. It's not a new issue, doctor. I have been underweight from I think my childhood, and you can see that I have been a bit short. Okay, so my weight is also not up to the mark. I I can say you that.
Okay. And any recent changes in your weight? Have you noticed anything?
Oh, doctor, I haven't noticed specifically.
And do you have any hot or cold preferences or any weather preferences?
No, doctor.
Any lumps or bumps anywhere in your body?
Uh, no, doctor.
Do you feel any whistling sounds when you breathe or any times?
Yes, doctor. I think I have some noisy chest.
When did you notice it?
Yes, doctor. I think it's from around when I was 13 years old.
I can get it. And do you feel any chest tightness?
Yes, doctor. On and off, I feel some chest tightness.
And any racing or pacing of your heart?
No,
And what about your bowel habit?
doctor. It's more or less okay, but doctor, I think sometimes there is some problem with my bowel movement. I think, doctor. Uh, I think that sometimes I have some problem of my digestion, and sometimes I think that the bowel motion is a bit greasy, doctor. I feel a bit embarrassed by it. I don't think that it gets flushed away easily.
And for how long you have noticed this?
Doctor, I think I've noticed it for around 4 or 5 years.
Okay. Do you think that you are a little bit sometimes constipated or have hard stool and sometimes have loose stool like this?
Doctor, I think I don't have that problem with loose stool, but I think that this issue is a bit bothersome. That it floats in the pan. It's a bit greasy, oily, and I have some problem eating oily food as well. So that's a bit bothersome. But no issues with constipation or something that lose motion.
And do you have any
Stomach.
tummy pain?
Doctor, sometimes
And where do you feel the pain?
I think in the center part of my tummy.
Does it goes anywhere?
Yes, doctor. Sometimes I've noticed that it goes to the back.
And have you noticed anything pain with relation to the food
Doctor, I told you that some oily food, I think it worsens the condition.
and your pain, tummy pain?
Yeah, yeah, yeah.
And for how long you are facing this?
The same time, doctor, around 4 or 5 years, I think.
And can you tell me that do you have any problem with your water work?
No, doctor, I haven't noticed it exactly.
And do you have any joint pain?
Joint pain, no, doctor.
Any lumps or bumps anywhere in your body?
No, doctor.
Okay. And You have been facing so many problems. Have you ever seek any medical attention for that?
Doctor, I think I told you that I had some noisy chest from my childhood. For that, they prescribed me some inhalers, and I have been more or less good with that inhalers. I didn't have this cough issue since the last 5 or 6 years. But at the beginning, this cough was actually not that much flame producing. It was actually quite dry. But as the days are passing by, it's producing more and more flame, doctor. So I'm now a bit more worried. Now those inhalers, I don't think they work at now at this moment.
Okay. And do you have you ever undergone any test, any imaging?
I don't think so, doctor. Or I can remember actually.
Yeah. Can you please tell me that if you have any childhood problem like asthma in the childhood or any lung infection in the system childhood?
Yes, doctor. I told you that from
You
bug
said that
infection.
you have asthma for a quite long time. Any bug
Yes.
infection? Do you know any of those?
No, doctor, I don't know of it.
Okay, that's not a problem. And may I know that what are the medications you're taking currently?
Sorry.
What are the medications you're taking currently?
I think, doctor, I take this inhaler on and off, but nowadays I have stopped taking those since it doesn't work.
And was your inhaler technique good?
Yes, doctor.
Okay. And do you have any allergy to any medication?
No, doctor.
Do you use any recreational medication? I'm sorry to ask.
No, doctor.
And any over-the-counter medication?
No,
Any herbal products?
no,
Any of your family members have this type of condition or any condition that runs in your family?
doctor. I don't know of that actually.
That's not a problem. Is it okay if I ask you few personal questions?
Yes,
Do you smoke cigarette?
yes, doctor. But occasionally.
Okay. And smoking is injurious to health and also related to your condition. So I recommend you to stop smoking totally. And if you need help, I can refer you to the smoking cessation clinic. Will it be okay for you?
Okay, doctor.
Do you drink alcohol?
No.
That's fine. And may I know that what do you do for living?
Doctor, I am a sports teacher in this local school.
And, I think this condition is affecting your job.
Yes, doctor.
In that case, I can contact the social care department and occupational care department. They can make some arrangement at your work so that you can feel better.
Okay, doctor. That will be helpful.
Do you have any recent history of travel?
No.
And is it okay if I ask you very personal question, such like your sexual history? Actually, it is very important to know.
Okay, doctor. Please carry on.
Uh, are you with any regular partner?
Yes, doctor.
And is he male or female?
Yeah, doctor. She is a female, doctor.
And does she have any condition, any medical condition?
No, doctor.
That is fine. And do you have any occasional or any casual relationship?
No, doctor. I don't have any relationship at all. Rather, I love my wife very much. But I am bothered, doctor, that I have been married for around 9 years now. But since till now, I don't have any issues. So I'm worried about it.
We will try to sort out that what's happening with you. And at this point, may I know that what is your concern?
Well, doctor, actually, I have so many problems, doctor. I told you that I have some problem with these cold issues. Now, I have some problem with my tummy, and also, doctor, since you didn't ask, I didn't tell you. I also have the diabetes from my 20 years of age, and now I cannot have this baby for such a long time. So I'm very frustrated, doctor.
Okay, I can understand, and I am sorry for that. And may I know that what medications you're taking for diabetes?
Doctor, I take insulin, doctor.
Okay, and is it diabetes under control?
Yes, doctor, more or less it's under control.
Before I give you the answer, is it okay if I examine you?
Yes,
So I'd like to examine the hands for any clubbing,
clubbing present,
any dorsal guttering.
absent.
Okay, then I would like to examine the pulse. And,
Yes, it's regular.
and also pulmonary rhythm.
No.
Then I would like to see for any injection mark in the arm,
Yes, injection mark present.
any IV medication mark,
Sorry.
any IV medication mark.
No IV medication.
Okay, and after that, I would like to see the eyes for any redness and anemia.
Anemia, mildly anemic.
And I would like to see the mouth for any oral thrush present or not.
No.
Okay. And after that, I would like to see the trachea if it is centrally present or not.
Central present.
Okay. After that, I will go for the neck gland for palpation of the cervical lymph nodes.
No lymph node present.
After that, I will listen to the lung for any crepitation or any.
Yes, there is crepes present in both lower lung fields, and also there is widespread wheeze.
Okay. And I would like to ask the patient to cough and then see the alteration.
Yes, it's altered.
Okay. And I would like to see the examine the sputum pot.
Yes, it's greenish
And at
phlegm.
this point, I would like to see the heart if it is left-sided or right-sided.
It's left-sided.
And after that, I would like to examine the tummy for any organomegaly.
Yeah, no organomegaly present.
At this point, I would like to examine for bedside blood glucose test and also urine for dipstick test.
Okay, bedside blood glucose is at that moment 7.2, and urine dipstick test just trace amount of albumin.
Okay. Thank you for giving me chance to examine you. And as I have taken your history and as I have examined you, it seems likely to me that you have a condition called cystic fibrosis. Have you ever heard of it?
No, doctor, no.
Actually, in this condition, there are some problem in the gene that regulates the body's water. So it cannot maintain the proper hydration of in the lungs. So you cannot cough out properly. So that they are something have been congested in the lungs, and they are causing this problem. And also this is also happening to the some organs in your tummy, so that you are having diabetes and you are having problem with your uh, tummy pain and also with your bowel habit. And for this, I am going to involve a group of doctors who are specialized into this condition, just like a physiotherapist who are specialized in giving you some exercise technique to you, and some hormone doctors and cyst doctors. They will combinedly give you the best management. Do you have any other question? Time up.
Okay, no, doctor, thank you. Well, so what do you think? What is your diagnosis?
For this gentleman, my provisional diagnosis is cystic fibrosis, and my other differential diagnosis is this can be a case of a bronchiectasis. Then this also can be a case of primary agammaglobulinemia, or and also can be a case of
Hypogonadism.
yes, hypogammaglobulinemia, and can also be case of secondary immunodeficiency, like from AIDS or from lymphoma.
Yeah. Okay. Okay. So, what investigations? That's very good. What investigations would you like to do in this patient?
For this gentleman, I will go for the routine blood test, like complete blood count to see anemia, then white blood cell count cell, white blood cell count level, and after that I will also go for the inflammatory markers like ESR and CRP, and renal function test, liver function test, urine for depistic test, random blood sugar level. After that, I will go for the lung function test in the form of a spirometry, and after that, I will go for the chest X-ray, then CT scan of the chest, and also ultrasonogram of the abdomen, and also some enzymes level for abdomen like serum amylase, serum lipase, and routine stool examination.
Okay. Okay. Well,
Yes, and also genetic study for CFTR gene mutation.
yeah. I was actually going to tell about this, that whether family screening is important or not.
Yes.
Okay. Now, what treatment do you think is important for this patient?
This is actually a multidisciplinary approach. First, I will educate and counsel the patient about the condition. Then I will go for the some
Well, can I just come back for 1 minute? Did you tell about blood culture?
no, sorry, I forgot
Or
to mention
sputum
that
culture?
blood culture and sputum examination. Totally forgot to mention that.
Yeah. I think it's important in this patient because he has told some change in his sputum color recently.
Yes.
So I think it's going to be important. Okay, continue.
This is actually a multidisciplinary approach. So first, I will educate and counsel the patients. Then I will go for some non-pharmacological management, like his lifestyle management, yeah, involvement of the dietitian for proper nutrition. Then involvement of the physiotherapist for the expectoration of the calf, and then I will go for the occupational health therapist, then social care worker, and also a specialist nurse for cystic fibrosis specialist, and after that I will also involve the general practitioner, and then I also involve the respiratory consultant or pulmonologist, then involve the endocrinologist for his diabetes management, and also genetic specialist.
Okay, and you have told about, but what do you think that what medication can be given in this patient at this moment?
Okay, actually, for his symptomatic relief, there are some medication like giving some expectorant that can help to cough out blood, like N-acetylcysteine, and also nebulization with hypertonic solution like 3% sodium chloride solution, and use of some special devices. Then for his sputum, for his history of fever and sputum color changes, I will go for the antibiotics. And for his fever, I will go for the antibiotics like paracetamol.
Yeah.
And
Okay, I think actually you have told quite, but I think some names I think the examiners might want to know. You told that about some specific physiotherapy. That's good. Okay, and in this medication part, I think if you just utter the name tobramycin, nebulized tobramycin, and also if needed, ceftazidime, piperacillin. I think these names, I think the examiners might want to know. Specifically, this nebulized tobramycin is getting more and more popular nowadays in case of pseudomonas infection. Okay. And at times also nebulized DNAs. Okay. So I think if you just can remember, but I think just nebulized tobramycin, I think this you can say. I think specifically I have uttered again and again that greenish sputum. I think it can be most probably pseudomonas. Okay. So in this patient, you can give these type of medications. I think. Okay, just for I think you can mention these things.
no.
Okay, and otherwise, I think it has been quite well. But I think you missed two important points. First of all, when I told, I actually gave the hints more than once that it's not a new issue, but you didn't delve into that quickly. You went into that at a later stage about the previous history. Okay, I think so. Secondly, you didn't evaluate all things, like there could have been diabetes in cystic fibrosis. You didn't go into that. Okay, and also when I told about my personal history, I myself told you that there has been some fertility issues. Okay,
Yeah.
Because infertility or subfertility is also a part of, can be a part of cystic fibrosis or cartagenars, both of them. Okay, so I think these things you should have asked, and otherwise I think it's been quite good. I don't think there has been any significant mishaps done. Can you yourself add anything?
Oh, I cannot remember. I was the performer, so I cannot add anything.
It's very normal. It's natural. There is nothing to be worried about. So I think you can we can stop this session.